Delighted now to introduce our keynote speaker, Dr. Di Winkler. Di established the Summer Foundation in January 2006. The Summer Foundation is changing systems to ensure people with disability and complex support needs have access to high quality housing options that enhance health, wellbeing and participation. The recent report, Innovation in Housing and Living for People with Disability, completed an international environmental scan, which has great lessons to share with everyone. I'm very excited to invite Di.
Thanks, Ashlyn. So I'm just going to start by just sharing my screen. And because I've got a few slides to share, so I'll just take a minute to do that. So now I'm hoping that you can see a slide, is that right?
Yes, we can see the slide. Looks great. Thanks, Di.
So thank you. Thanks for your time today, and really appreciate the opportunity to speak to you about innovation in housing and living. I'd like to start by acknowledging the traditional custodians of the various lands on which we live. So I'm on the land of the Wurundjeri people, and I'd like to pay my respects to elders past, present and emerging. I'm just going to start by sharing a 3-minute video just that provides some context about why the Summer Foundation is now working on innovation and in housing and support, because we did start off specifically focusing on the issue of young people in aged care.
We're excited to announce that a new dawn is coming for the Summer Foundation. Since we were established in 2006, we've had a significant impact on solving the issue of younger people in residential aged care. We created the 10+1 housing model for people with disability with high support needs. This has led to the creation of more than 2,000 enrolled specialist disability accommodation apartments all over the country. We've successfully lobbied the government to change the building code as part of the Building Better Homes campaign, resulting in an anticipated 103,000 accessible homes to be built by 2027. Our advocacy helped lock in the government to measurable, time-bound targets to solve the issue of younger people in residential aged care by 2025. Most importantly, in collaboration with other organisations, we've helped more than 7,500 younger people avoid residential aged care. And we established the Housing Hub, which has provided expert support to more than 1,200 people with disability to find a home. But the promise of the NDIS has not been realised for many of the people who need access to 24/7 supports. That needs to change. And the Summer Foundation needs to change to help deliver on it. We're relaunching with a bold new vision, focused not just on younger people in residential aged care, but the more than 40,000 Australians with disability who need access to 24/7 supports. The only option for many of these people is to live in group homes, where the support is often poor quality, expensive, and puts people at increased risk of violence, abuse, and neglect. Our research and experience shows that better outcomes are possible and affordable for government. People with complex support needs have the right to equitable and inclusive housing, support, and services. But we can't do it alone. We're looking for like-minded collaborators to help us bring about a new dawn in housing and living for Australians with disability. Better is possible. Help us make it happen. We're excited to announce that a new dawn is coming for the Summer Foundation. Since we were established...
Sorry about that. Yeah, so the question I'm going to tackle today is what housing and living models enable people with disability to live independently within supportive, integrated communities. I'm going to start by sharing some findings from research that measures outcomes of people moving into new housing options. Then we're going to look at what we're learning from work that we're doing to explore innovation in housing and living. And then just going to finish touching on just the ongoing challenges of belonging and community inclusion. So as outlined in the video, the Summer Foundation pioneered the 10+1 model in Australia. This model generally has 10 accessible apartments scattered throughout a larger residential development. And then an extra apartment provides a base for disability support workers. So people get to live in the community like everybody else and have neighbours like everybody else, but they also have access to 24/7 on-site support. So in an initial study, we measured the outcomes of people moving from a range of environments, including group homes and living with parents, into apartments. And the pilot study found significant improvements in health, wellbeing and community integration, trends towards improved health. Daily support hours were reduced by 2.4 hours, and less tenants required overnight support. So we're also getting some really terrific insights from the in-depth interviews about what's working and not working for people living in apartments. But I guess what we're also finding is there's real variation in how the 10+1 model is operating across Australia. So we have some disability housing providers that have set up the model so that the tenants can choose their own provider for personal care and community integration. And on some sites, tenants have a say in the appointment and management of the shared support provider. But we're finding that other providers are just delivering the support in a similar way that they would be in a group home with a similar culture. So I guess one of the learnings for us over the years has been that it's relatively straightforward and easy to build a great environment, but the biggest challenge, and I think this is where there's the opportunity to make the biggest difference, is redesigning how support is delivered within someone's home. So we're expanding this study, and we're starting to look at the outcomes of people moving into a range of settings, including different types of disability housing, so share houses, townhouses and villas, but also looking at the outcomes of people moving into individualised living arrangements, or ILOs as they're called with NDIS funding. So we need to recruit 150 people moving into a range of new housing options in the next 12 months. And this longitudinal study will run for another 2.5 years. We're really passionate about outcome data because we think that it's absolutely crucial for informing service design and also improving outcomes for people with disability. So as Ashlyn said, our starting point for exploring innovation in housing and living was an initial environmental scan that was published last year. So I guess we were really interested in looking at how the built environment, the technology and support might work better together to enable people with disability to live with dignity in the community. And I guess the findings from this initial scan, they were really useful, not mind-blowing. We didn't identify anything that was very different from what we already knew about. But the scan was really helpful for just pointing to areas that needed further exploration. So at the Summer Foundation, we're currently exploring 4 areas where we think there's scope for innovation and improving outcomes. We're also doing some economic analysis because we want to better understand the cost drivers in the current model of providing support in disability housing. And we're also testing potential solutions and getting insights from people with disability. So I'm now going to talk about each of these 4 areas. self-determined lives, the governance of shared support, flexible and responsive support, and then finally shared lives. So the NDIS review found that particularly for people with cognitive disability, there was limited opportunity to be involved in making decisions, including big decisions like where to live, but also smaller decisions like how to spend time during the day. And at the moment, we see two main opportunities. So there's a big opportunity just to help people with disability to know their rights related to their home and support, and know what to do and how to make complaints or how to provide feedback. And then the other opportunity is tools and resources that enable people with disability to be more in charge in how their support is delivered. So what have we done to date regarding self-determined lives? We've co-designed a series of resources that was funded by the Quality and Safeguards Commission. And these resources are now available on the Housing Hub website. So these are resources to support people to know their rights and make complaints and provide feedback. And then the other thing we did is a few years ago, we co-designed a process called participant-led videos. And this was about enabling people with disability to develop training videos for support workers. And this intervention was specifically designed for people with cognitive and communication difficulties. So now we're looking at how we might develop an app or a platform that makes it easier to produce these videos. The other thing that we've done is a market scan, because I guess when we were thinking about developing an app for participant-led videos, we wanted to make sure that we weren't already duplicating something that was out there. And so from this scan, we found that we are not duplicating an existing product, but we've also identified some other resources with potential for impact. So what are we doing next? We're going to disseminate the resources about rights and look at getting them into the hands of the people who need them. We'll be publishing the market scan related to participant-led videos, and we're also starting to do some user testing on some other promising digital resources. So with the governance of shared support, the problem we're trying to solve is that within disability housing, people with disability often have very little say over who provides their support and how that support is delivered. And in a lot of disability housing, the rhythm of the household often revolves around the needs of staff instead of the needs and preferences of people with disability. So the opportunities we see are looking at how we might redesign how shared support is delivered in housing, and having people with disability actively involved in the governance of shared support. And we think this has a lot of potential to transform services. So what have we done? With the 10+1 model, our researchers found that choice and control around support really varies across sites. And so we have done a series of co-design workshops to explore the challenges and potential solutions with the tenants, with housing providers, and with support providers. We've also recently completed an evaluation of shared support facilitation, a pilot that was implemented by Enliven. And then with governance models, we've also done some initial research and co-design work, looking at the possibility of co-ops of NDIS participants and how they might commission support services. So what next? We're publishing the evaluation of the Enliven model. And we're also recently awarded a grant from the Quality and Safeguards Commission to develop a disability housing and living index. And this index will measure housing and living arrangements against the UN Convention on the Rights of Persons with Disability, and especially Article 19. And we see this as an opportunity to really define what good contemporary disability housing and support looks like and set some new expectations in the sector. And we're also part of this, the role of this index will be to enable providers to benchmark their services. So the problem we're trying to solve with related to flexible and responsive support is that people with disability are telling us that they used to be able to do some things independently, and that for some people, providers are now insisting that they have a support worker with them. We also know that other people with disability and some of the people that I've worked with over the years, they find having support workers in their home for hours at a time challenging or inconvenient, but they would really benefit from having access to 24/7 telesupport so they can get assistance with problem solving when they need it, when they get in a pickle, but they don't have somebody kind of with them when they don't need it. So some people, they don't want just the option of having workers scheduled to be in their house. They need more flexible options. The other thing we know is that with the opportunities that there are a few providers delivering flexible support models, but these services have struggled rather than flourished with introduction of the NDIS and individualised funding. So we think that there's an opportunity to think there's scope for providing a broader range of services to people with disability, not just scheduled shifts of disability support workers. So what have we done so far? We've identified and met with and interviewed current providers because we want to understand what they're delivering and what's working. We've also commissioned an environmental scan from the University of Sydney to look at technology with the potential to increase the quality and efficiency of disability support. And then we've also started testing concepts for new service offerings with people with disability. So what next? We need to spend more time with the current support providers to really understand the current business models and their challenges. And we're also really interested to interview current users of these services because we want to understand what's working and not working for them and really understand what the value proposition is for them compared to a scheduled disability support worker. The other thing that really came up within the environmental scan is just some of the privacy issues with monitoring technology. So I guess what we're thinking a lot about is how do you make technology available to people with disability, but also make sure there are frameworks that ensure that technology, particularly monitoring technology, is not imposed on people with disability and just impinge on people's privacy particularly. And finally, we're also exploring shared lives. And so I guess with this topic, the problem is that we really anticipated that individualised living arrangements or individualised living options would flourish in Australia with the introduction of individualised funding available from the NDIS. And but instead, the number of people with disability that have access to ILAs has decreased rather than increased since the introduction of the scheme. And ILAs are mostly only available in Western Australia. So we think the opportunity is to look at how a range of ILAs might be made available to more people with disability across Australia. So what have we done? We've completed a market scan of ILA providers. We've done a study tour to meet ILA providers and people with disability using the services. And we are working with an economist to understand the cost of ILAs relative to group homes. We're also working with some researchers at the University of British Columbia to learn how ILAs have been scaled in Canada. We're also planning some research to look at the outcomes and costs of ILAs in Australia. So what next? We're going to publish the research that we've commissioned, and we're also working on a shared lives policy solutions report. So in conclusion, we think there are some promising solutions, but there's just no one model that's going to work for everyone, which is kind of quite obvious. And I guess what we really want to see is a range of options and real choice. And as I mentioned before, the physical build is the easier piece. The challenge is really how you make sure that the support is individualised, tailored, and delivered with dignity and respect. And I guess the other thing is with community inclusion and belonging, it doesn't happen automatically. So some people are getting good outcomes in terms of community inclusion and participation, but not everyone is. And I think one of the challenges with that is that some organisations use social isolation as a reason to justify more segregated living arrangements, saying things that people will be lonely in their own apartment or unit. And I think the underlying assumption is that people's only possible friends are other people with disability. And don't get me wrong, I think that we want to see a range of options and we want to see people living with other people, not always kind of single occupancy options. But I think we're just not doing enough to enable people to be included in the community and belong. And I think part of this is that most disability support workers, I don't think, really understand their role and often get in the way rather than support community inclusion. And so the best disability support workers do themselves out of a job. And so in terms of housing and support, more inclusive housing and support is just the first step to community inclusion. Most people need a skilled person to support them to explore interests and hobbies and identify places in their local community where they might belong. And yeah, we really believe in Australia that we're just not doing enough to kind of go beyond just housing and support and enabling people to be included and belong in their local community. Thank you for listening.
It was a wonderful presentation. Thank you very much, Di. I can see lots of interest in the research and the insights that you've shared. So thank you very much. We really appreciate your time.